Today we are going to be discussing the anatomy of the back and types of back pain that can occur. The spine's main role is to protect the spinal cord and provide structure and space for the body's internal organs. A human spine is made up of 34 bones called vertebrae. These are separated by intervertebral discs and are held together by a vast array of ligaments. Muscles attached to the spine help it to move, and the shape of the bones and the layout of the ligaments surrounding these bones dictate the amount of movement available at each joint. The intervertebral discs are fluid-filled sacs, which have the role of providing shock absorption, as well as giving the vertebrae space to move and holding them together. I'm now going to move on to talking about different types of back pain. Broadly speaking, there are 4 main types of back pain. The first is acute lower back pain. This is usually self-limiting, easing within 4 weeks and lasting no more than 3 months, regardless of treatment. Acute can mean that it comes on suddenly, and it is often severe, with people describing it as, "My back just went." This type of back pain very rarely requires an MRI scan or X-ray unless it was preceded by trauma, such as a heavy fall onto the floor or down the stairs. If scans are carried out, they will likely not show anything beyond age-related wear and tear, of which the vast majority of people without pain will also show. Muscular spasm is a common cause of acute low back pain. Unfortunately, this can be extremely sore, but this often eases on its own. Certain conditions may cause a sudden wave of acute pain, and it is important to manage these appropriately to minimise flare-ups. Osteoarthritis is a good example of one of these conditions and can be easily aggravated by overactivity or working in an awkward position for a prolonged period, such as weeding in the garden. This can cause an apparently sudden flare of acute low back pain. Mechanical lower back pain is the most common form of low back pain in adults and is also known as non-specific or simple lower back pain. Usually, people with this sort of problem find that they can generally perform most daily tasks without being restricted, but may suffer if they overdo it. For example, they may find that they have more stiffness by the afternoon or the next day if they do more than usual in the morning. With this kind of back pain, scans should not be offered as routine because, again, they are unlikely to show anything more than age-related wear and tear, which most people will have regardless of their symptoms. Such investigations can actually be counterproductive and may even be harmful to your recovery. Sciatica is the third form of pain that we are going to talk about. This is when lower back pain can be accompanied by pain that radiates into the buttocks and the thighs. When pain is referred down the leg, this can be accompanied by irritation of the sciatic nerve, possibly from the nerve root in the lumbar spine, and is referred to as sciatica. This type of pain accounts for 5 to 10% of all lower back pain referrals. Sciatica can also be accompanied by neurological signs and symptoms such as pins and needles, numbness, or altered sensation and muscle weakness. The location of these symptoms will indicate which nerves are affected and the potential nerve root that may be the cause. The vast majority of people with sciatica will get better with time, usually 3 to 12 weeks. However, in more severe cases, the symptoms can be severe and debilitating, and occasionally surgery is offered, but this should always be the last resort. Chronic lower back pain is defined as pain that has persisted for longer than 12 weeks. The evolution of this type of back pain is complex and multifactorial and has psychological, physiological and psychosocial elements. Generally, injured tissue from an acute injury will take up to 6 to 8 weeks to heal, but symptoms can persist despite the structures around the painful area having healed. There is often a reluctance or fear to move due to pain or anticipated pain, but often these habits can become disruptive to your recovery and confidence to return to normal life. This graph shows the relationship of normal healing compared to pain experienced in chronic pain. As you can see, once an injury has occurred, pain naturally increases. This will settle down as the injury recovers over the next few days or weeks in the majority of people. However, some people find that they experience persistent pain, shown by the highlighted purple area on the graph. This is where there is no tissue damage, but the pain does not reduce. When you have back pain, it is important to stay as physically active as possible, even when it is acute. Whilst bed rest may provide some temporary relief, if this is continued for too long, it may actually make the symptoms worse and prolong your recovery. Exercises provided by your GP or physiotherapist and gentle activity like walking is recommended as pain allows. Research has shown that people who continue to work during an episode of sciatica recovered more quickly than people who stayed at home. Surgery should only ever be a last resort. This may be considered if conservative treatment has failed or severe neurological symptoms persist after the expected time frame. We have now reached the end of this session. Thank you for listening.